To begin by just thanking all the members of the panel that you'll hear from today, but to thank each of you for joining us. It looks like we have about 460 people already signed in. And so this will be a great forum full of rich information. And hopefully we give you the information that you need. If we don't, we'll make sure that we post answers to the questions that we can't answer today on our frequently asked questions. I wanted to begin by talking about, of course, what's on most of our minds, and that's COVID and the impact of the Omicron variant of the virus. We know it's moving quickly. We're seeing many examples in other states that give us a couple-week head start on knowing what to expect. We've seen a rise over the last week, and our public health experts and our infectious disease experts in the state have predicted a kind of a 3-week increase followed by a plateauing and then a 3-week decrease after that. Know that we're watching the data very, very carefully. We'll make smart decisions, just as we have over the last year and a half, on your behalf to make sure our campus can continue to operate safely and smoothly. When I compare it with where we were last year, when we had the surges in August and then in November, keep in mind that we didn't have vaccines at that point. So the vaccinations are still our best protection, but all those actions that we talk about, wearing masks, washing your hands, trying to keep a distance from others, those are all still good strategies. Omicron is highly infectious. It's more infectious than the previous variants. But we're paying very, very close attention to its trajectory. We know that the reports of hospitalization as a function of infection tends to happen at a lower rate than what we've seen in previous variants. Nonetheless, when you have a lower percentage of hospitalizations among a much larger group of infected people, we still need to watch very carefully on what's happening in our local hospital system, and that we are doing. But it's important, I think, for all of us to know that we're monitoring critical services, dining, housing, our ability to keep the campus going. And as we see indicators, we'll keep you posted, and we'll make smart decisions on your behalf. But I know there'll be more questions along the way for our esteemed colleagues here on the call. I also wanted to let you know, second point is about the strategic plan update. So we have our current One UND strategic plan. I wanted to announce that on February 17th, we'll have a kickoff meeting to begin the next phase of our strategic plan. And this, my hope is to have a broad segment of our campus, our entire campus, come together and discuss the strategic direction, the long-term direction that we'd all like to go together. So there'll be that opportunity, and the plan will emerge over the entire year. We hope to have the final plan written in December of 2022. The third thing I wanted to talk about is news coming out of Bismarck. Actually, a letter was written 2 days ago on the 10th by the North Dakota Catholic Conference. They issued a letter about a draft policy at the University of North Dakota regarding gender inclusion and gender identity. And it's important for me to talk about that today, just so you're aware, because you will likely read about it in the newspapers or hear about it from neighbors. The draft policy on gender inclusion was not a case of a campus going rogue. In fact, we began drafting this gender inclusion policy to implement federal law, Supreme Court rulings, State Department of Labor and Human Rights policy, and the State Board of Higher Education policy. Our draft policy is intended to protect transgender members from harassment and discrimination, consistent with those federal laws and state policies. The Catholic Conference's letter makes claims about that policy, that draft policy, that simply are not true. Yet we appreciate their public statement about treating others with respect, which is the aim of any policy that we adopt. We are certainly firmly committed to free religious expression and fully recognize that as we address the rights of one group, we cannot do it to the detriment of the rights of another group. And when we face such challenges, I'm convinced that there's no better place than our campus to resolve such conflicts as we come together as human beings to arrive at good solutions for all. And we will be announcing a press conference on Friday to discuss this issue, and we welcome an open conversation with the Catholic Conference leadership to clarify their misunderstandings of what was included in this draft policy. But to each of you, please know we fully support the rights of our LGBTQ+ community, as well as the members of religious groups on our campus. No human being should be denied the right to an education or employment at UND on the basis of any legally protected category. So more to follow on Friday as we announce a press conference on that day. With that, let me turn it over to our renowned MC for these events. Vice President of Finance and Operations, Jed Shivers, does a great job talking about the issues of the day and really directing responses and questions to the members of our panel. So Jed, over to you.
Thanks, President Armacost, and thanks everybody for attending. It's great to see so many people, coming on to these forums, which I think are really terrific. So glad that we have them. I often give a little preface about COVID. I think that President Armacost has done a wonderful job in really summarizing where we are. The only thing that I would add is if you ever want to see good data about where we are state by state and also internationally, the Financial Times offers a free section on their COVID data. They're highly quoted. They're highly regarded as an excellent source of graphic information. And if you look today, what you'll see is that some of what President Armacost is talking about may be coming true. As Josh Wynn would say, it takes more than 2 points to make a trend. So I'll say that caveat. But in terms of state by state data, if you start to look at Florida and New York, you are seeing them retreating from their spikes. We'll see if that actually, continues. That's in terms of the spike in cases. Today, they're a little bit, both are lower than they were yesterday. If you look at our neighboring states, Michigan, I think is also in the same place. Wisconsin and North Dakota are continuing to rise somewhat. And I think the anticipation will be that, as President Armacost said, we'll see more cases than we've seen in a long time. And the real question is whether or not those cases will result in, really severe pressure on our healthcare systems. And that's really what we're going to be looking out for. Case count is one thing, but really understanding what the consequences of that case count is going to be key in my mind. So with that, let's move on to some questions. And I've got a few, and I'm, happy to, go through them with everybody. So I think one question was, faculty, staff, and students are required to wear masks indoors in public areas. Are construction's maintenance workers exempt from this requirement? I see many of them are not wearing. The answer is that in terms of indoor mask wearing, the university is under a mask mandate. We have, people who work for us who are our employees should all be following that mandate. We welcome feedback from people if they have concerns about people not wearing masks, unless those people are completely, maybe they're completely isolated, there's nobody around them. But generally speaking, people should wear masks indoors. And of course, when it comes to, we have many construction workers who are not our employees. They're employees of the construction companies that we're utilizing. But again, we welcome that feedback, and we will provide that information back to our construction partners to make sure that they are adhering to the mask mandate as well. So thank you. Question for Andy on the strategic plan. Has the group leading the strategic plan been identified, and what was the process? I assume the question is, what was the process in putting that group together?
It's a great question. We're putting that group together as we talk today, and there's the process will include invitations to representation from the two previous task forces on the future of education and DEI. Invitations will be going out to the staff senate, to the university senate, and the student senate for volunteers to participate in the strategic planning process. There's a broad set of solicitations that will go out, but that committee has not yet been formed. That's in the process. We will certainly hope to do that before February 17th. So if you're interested, you can either participate by volunteering to serve on the committee, or on the 17th, we'll be soliciting essentially inputs via a Qualtrics survey for thoughts on the direction we should go with the strategic plan, as well as volunteers who might want to contribute to the working of this strategic plan. Thanks.
Thank you. Another question, and I'm going to direct this to Jen Berger and I think Alex Pokonowski as well. If a student tells us that they tested at home using a home kit, should we ask for more official documentation or a more official test, or just assume that they're providing us with accurate information? Jen, do you want to address that first?
Sure. We just talked about this at our public health partners call this morning, and the state is updating their website to reflect information for people who utilize home tests. They are instructed to isolate at home and not go to a testing center to get a second test. And so that home test is considered a positive result.
Okay, Alex, any amplification?
Yep, can I add to that? What we would ask is that they still submit a VOC report, so then the university would be aware of that positive result. So then we can go through our notification processes as we do for other students or faculty or staff when they learn that they test positive for COVID as well. And we've actually started to get these specific questions, especially from our students in other states, as they're returning to campus. They've shared with us that they've tested positive at home. And so we've already started to see that.
Oh, this is great. To get a nice definitive response like that from the state, I think is really helpful, because now I think people have a good understanding of where to go, because there was a little bit of uncertainty about where we were going to go with home tests. So that's terrific. Let's see, next question. Let's see. I'm just trying to read through the question and sort of get to the part of the question. This is from a faculty member. My concern is with the home COVID test, students may take and report as positive or negative. For extensions on coursework for COVID, I have asked students to provide documentation of their test results. With the home test, there is no official documentation. So this is really more about the academic administration side of the house. So here are my questions. Is it wrong for me to request documentation of the COVID results since there is ample opportunity for students to test on campus? Can I ask a student who took a home test to be tested on campus? So I think the answer we've just gotten is there's no need for a student to take another test from the standpoint of determining COVID status. So I think the real question is what documentation is acceptable relative to providing extensions on coursework? And I think I'm looking toward maybe either Provost Link or Dr. Karen Plum perhaps to comment.
Thanks, Jed. Good afternoon, everyone. I actually have to defer some of this to maybe some of the other experts on the panel in terms of what kind of documentation would be suitable in terms of trying to demonstrate that someone really did take a home test and really did get the result that they're reporting. So I don't have the answer to what specific documentation we could ask for and what would be allowable under those conditions. But what I will say is what we've asked everyone to continue to do is to exhibit a kind of flexibility and grace in these situations. I understand that there may be a student here or there who wants to use the system to their benefit, but my hope is that the majority of our students don't fall into that category. And if they report that they've tested positive at home, I hope that we'll extend a certain amount of grace to them and work with them so that they don't fall behind in their studies. Now, if anyone else on the panel has some better information about what's allowable in terms of required documentation, I'll pass the baton over to you.
Thanks, Provost Link. Any other commentary, or are we good to go? Okay, not hearing anything. Let's move on to the next question. So this is a question for Josh and perhaps Dr. Josh Wynn, and also maybe President Armacost as well. Question is, why are masks still required when 1/5 of the students are freshmen and they don't wear masks in any of the dorms? All public schools have gotten rid of the mask mandates, and there's a lot of information that proves that masks aren't effective. So Josh, if you don't mind, maybe it would be good to kind of answer the question about the efficacy of mask wearing. And then maybe Andy, if you don't mind, you could comment on the issue of the mask mandate in general with respect to what our partners may be doing in the community.
Thanks, Jed. Good afternoon, everyone. Yeah, so the mask issue obviously has been both medical as well as political and social, and is a complicated issue. Let me say this, that there have not been wide-scale, rigorous, randomized trials. That is correct. However, what we know through all sorts of somewhat anecdotal information is that particularly the higher efficiency masks, such as the N95s, do appear to be protective. It is true that with the highly infectious, as you've indicated, Omicron variant, the efficacy is undoubtedly less. But as an example that the medical community continues to consider this important, I can assure you that when I was seeing patients yesterday in a clinic with one of the large providers in North Dakota, everyone was in a mask, and most of us were in N95 or the equivalent. So the higher the efficiency of the mask, the better it is. And from my point of view, something is better than nothing. And as a physician, I continually evaluate risk-benefit ratios. The risk here is close to zero. The benefit is not completely certain, but is probably at least moderate. And therefore, I think it's straightforward that we should continue to do it, particularly the higher efficiency masks. Thank you.
Thank you.
Yeah, and to discuss the issue of what others are doing in the community, there is no countywide mask mandate. And furthermore, we see the decision by the public schools to release, I think it's on the 17th of January, the mask mandate. Now that's driven largely by difficulty in keeping children compliant with wearing masks. And the teachers are spending a lot of time actually handling that rather than teaching. So they've made a calculated judgment. We fortunately have adult students here who, when we ask them to wear masks, hopefully they have the wherewithal to say, we will do it. And that's the expectation on the campus. So when I combine our ability as adults to comply with such a mandate and the medical benefits, even if they're marginal, and the low risk that Josh talked about, it makes sense to keep the mask mandate in place for now, right? Nothing is forever, and we'll see what happens over time. Hopefully the Omicron dips after that 3-week surge that we're expecting.
Thank you. Question for Peggy Varberg, our Associate VP for Human Resources. If a staff employee is remote due to an accommodation through HR because of a medical reason and the pandemic, but their position was not created to work remote full-time, at what point can we expect those employees back? And really, I think the point of this question is it's a morale killer when offices aren't fully staffed and those remote aren't held to the same standards and accountability, making more work for the employees on campus and in person. Now, this is I think to the extent that that's true, it's a real issue. I think people always are concerned about whether or not people are being treated in the same way, there's fairness and equity across the campus. So Peggy, do you want to comment on that?
Yep, you bet. So thank you. So first, with the work output, they should be held accountable, the same level of accountability as anyone who's working on campus. And so if there are issues with performance and so forth, we know that supervisors do deal with that. And so if that's something that should be shared, you can either work through your HR manager, call myself, or work with that employee and their supervisor directly. With regard to the remote, if they have an accommodation due to COVID, there is likely a health reason why it's not the best for them to be in an environment with lots of people. And so we work consistently with the employee and their medical provider to ascertain when it really would be okay for them to come back to campus. So some of those have been longer due to health-related issues. Some have been able to come back quicker. But just know that we are working with the employee and the medical provider to make sure it's safe for that employee. And that's always what we want, is to make sure it's a safe environment for our employees.
Thanks, Peggy.
Yeah.
Just another quick item on masks. So this question starts out, other than because we are federally mandated, why have a mask mandate when there's absolutely no enforcement or consequences for not wearing one? It feels like, quote, you should be really wearing a mask, wink, wink, unquote. So I think this is a reasonable question. And that's why I did want to talk about it for a minute, because the fact of the matter is that, we don't have strict, reinforcement. We don't have people functioning as the mask police, but we do have, and I think President Armacost spoke to this just a moment ago, an adult population, generally speaking, of people on this campus. And there is an expectation that they will do, what they ought to do in order to safeguard their own health and maybe more importantly, safeguard the health of others. And as the Omicron virus becomes, more prevalent, even if it might be slightly less severe, and we'll see, whether or not that turns out to be true, it's going to be even more important to wear a mask. So for example, I'll just give an example in my own division. As when we were going through kind of a lull period prior, like last Thanksgiving-ish, that time frame, every so often you'd see people in meetings and they were socially distanced, but people weren't wearing masks and there wasn't, always that super duper, compliance. Now we're wearing masks, right? I mean, we know Omicron is here. We can read about it just like everybody else does. And so when people are in meetings, when you walk into someone else's office, when you do all those things that put you in contact with somebody, wear a mask. It's not that big a deal. It's not really much to ask for from my perspective. And I think it does have a degree of efficacy, particularly if you're wearing a good one. And we have them. So there's no shortage of masks here on campus. I think we have 10,095 masks. So they're here to be distributed, and we've reached out to various parts of the campus and said, what do you need? And we'll provide them to people. So I think really, when you think about it, even though there's a lot of pulling and tugging, like, how come you don't hammer this? How come you don't enforce this? At a certain point in time, we really do rely on people to exercise good judgment with the information that we have. And I think, oftentimes that's what we see happening. Any other commentary on this matter from anybody?
Just a quick comment from me, Jed. The fact is, if I see folks who aren't wearing masks, I address it with them, and we can all do the same. And there's a way to do it with respect and with a sense of hope that they'll comply. Somebody could be insistent and not comply. But what I've found on campus, and maybe it's when the president walks up to you, the reaction is different. But I would like to think that that as human beings, if somebody asks one to wear a mask, that we would get compliance. Right now, it's passive. And furthermore, when we had a strong expectation that everybody should wear masks, this was last summer, we had 0% compliance, right? So we know that having a requirement actually strengthens the compliance. It might not be 100%, but there are things we can do actually interactively and as human beings to drive towards 100%. Thanks.
Dr. Alex Pokonowski, did you have any comments you wanted to make along these lines?
Yeah, I was just going to add in a piece moving from the enforcement into the consequences or response, specifically in the classroom. If there are students who are non-compliant, you can report that to the Office of Student Rights and Responsibilities, either through raising a student behavioral flag in Starfish or through calling the Office of Student Rights and Responsibilities directly. And we have and will continue to respond to those when we learn of those kind of habitual or continual non-compliant related people, both in and out of the classroom, but we've seen it a number of times in the classroom and then in our dining facilities as well.
Thank you. And I think that probably raises a good point that, especially when you're going into a setting where, you're, say, for example, in the dining hall. And honestly, we really want to make sure that we can continue to provide food services here on campus. That means we want to keep our dining personnel safe. They must be on campus. Not only do they need to wear masks, obviously, but we're really hoping that students will, comply with the need to wear masks to keep those folks safe. I think there's a quick one. I think Karen Plum probably answered this. I believe the question was, what's happening with the career fair? And I think the answer to the question is February 1st, but it's changed to virtual. I think I'm getting that correct. So if I'm not getting that correct, just let me know. Okay. Provost Link.
Jed, I don't know as though the decision was made to move it virtual in terms of the career fair. I can't say that for certain, but My understanding is the career fair is going to happen on the 1st. Of course, we will be encouraging mask wearing and all other precautions, but there's a lot of vendors who are signed up to participate in this event. It's important for our students, and it's a really important event that we have twice a year. So we want to go forward with this event if conditions allow.
Thank you. Question for Dr. Nguyen. Which mask is preferred? Now we're getting into it. KN95 or N95?
Thanks, Jed. So there are a number of issues here that we need to talk about. The first is what the actual filtration capability of the masks are. The second is whether they're certified by the federal agency that certifies these. That's the N95. And then the third question is the one that we touched on earlier, which is really how effective are these in preventing especially transmission of the Omicron variant. Clearly, we know that a properly fitted N95, that is the one that is certified by the federal government, undoubtedly offers the highest level of protection. So when I'm in the hospital, if I were seeing a patient with COVID, I would use one of the fitted N95 certified masks that I've been fitted to. Hospital personnel typically go through a routine where you get fitted with the proper shape. They put aromas in the air to see if you can smell them and so forth, testing the fit on your face. That is the best. The next best, and it's certified. The next best would be the K95 or the KN95, which typically are foreign variants of these that usually do not have federal certification of them. That would probably be the next level without an ability to distinguish between them because studies have not been done. And then lower down is probably the cloth and other masks. So that would be the 3-level priorities that I would put.
Thank you. All right, next question. There have been many tests with masks of, I'm not sure I'm completely understanding this sentence, but I think this is also a question for Dr. Nguyen. There have been many tests with masks of late where carbon monoxide buildup seems to be a major concern, where parts per million can become at dangerous levels. Is there a concern? I think the idea being mask wearing could be hurting people as a function of carbon dioxide buildup.
Yeah, well, to some degree, I have to express unfamiliarity with the reference to reported recent tests. I'm not aware of good data to indicate significant levels of hypoxia associated with the wearing of masks. I can tell you parenthetically, with an N of 1, my oxygen saturations remain unchanged when I'm wearing a mask, but that was just a personal observation. So I'm not aware of it. That doesn't mean it isn't so, but I will say that the federal government and the state government have not raised any alarms in this regard.
Thank you. A question for Dr. Pokarnowski. Are masks now required in the residence halls? I was informed it was optional. If so, when did it change? I guess it would be changed to mandatory.
They are not currently mandatory. They are required for residence hall meetings, but not for regular life within the residence halls. And that has not changed.
So for example, if you're someone who's sitting in their room with presumably your roommate who you've been rooming with for a while, you're not requiring those two individuals to wear masks.
That is correct.
But when there's a group meeting of a whole bunch of people that don't necessarily live together in close proximity, then people should wear masks.
That is correct, yes.
Thank you. Question for President Armacost. Is there any chance we may go virtual sometime during the semester?
Well, throughout this pandemic, there was always that option. Of course, we exercised that option immediately back in the March of 2020. We don't want to rule out any any possibility. My goal is to make sure that we deliver the education in the most effective way and the way that our students are expecting it. There's a huge demand for face-to-face. If it becomes untenable and the trajectory of the pandemic doesn't permit that, we will make decisions accordingly, and virtual instruction is one of those options. Let me turn it over to Provost Link for any additional comments.
Thank you, President Armacost. So before I make comments there, I just want to return to the career fair. It looks like in the Q&A that Dr. Plum answered that it would be an in-person event. And I saw another question come through asking if masks could be required at that event. The practice has been up until this point to follow the regulations in place at the site of the various events. So unless that practice changes, then we will continue to, of course, ask staff members and those who are working the event to have their masks on and set a good example. We'll be encouraging masks. But without a change in policy, I'm not sure that we'll be able to require masks at that event. So I just wanted to cover that. So our goal, in terms of going virtual, our goal is to keep campus open and operational. We've put in place a variety of health and safety measures in order to try to achieve that. We've been discussing those things in this town hall and in previous town halls, including the mask policy, ongoing encouragement to get vaccinated as the single best method we currently have of staving off the infection. For those with breakthrough infections, vaccines are the best method we have that I'm aware of to stave off a serious or potentially life-threatening illness. We continue to closely monitor local, regional, and national data on the transmission and impact of the virus. However, we also understand that in order to prevent long-term disruptions to our educational mission at UND, we may need to adopt some short-term strategies, such as moving instruction into hybrid or fully remote modalities across campus. We would render that decision, presumably, if the continued operation of the university as normal would likely result in a significant diminishing capacity to meet the educational objectives of the university. The obvious question there would be, well, what are the metrics? Like, what would you be tracking? And there is no one single metric that we are tracking. In fact, in our Tuesday and Thursday pandemic meetings, in our EC pandemic meetings that happen on a weekly basis, we're looking at a number of data sets routinely. We're looking at Grand Forks County health data, CDC recommendations, transmissibility information. We're tracking faculty health and well-being, including the infection rates among faculty populations, student health and well-being, including infection rates among student populations. We're looking at our ability to continue to sustain our capacity to offer certain critical services on campus, dining, housing, critical maintenance, police and safety services, health services, and so forth. So as we continue to track all of this, while our goal is still to keep campus open and operational, if we get to a place where we need to render a short-term go remote policy, that will be communicated to the entire campus community at that time.
Thank you, Provost Link. Just quickly, a couple more follow-ups on masks. So one question was, can we define a mask? I think Dr. Wynn has done that for us. He sort of laid out the three masks, mask types. There was another question about, some thought about students might be throwing away boxes of masks in classrooms, and should faculty bring boxes to their classes? I think we will continue to distribute masks. Jen Berger, how many of the blue masks do we have in stock?
We just ordered another 100,000 disposable masks, so we have plenty of masks in stock.
Okay, so I don't think we want the faculty to be bearing the burden of carrying boxes of masks around unless they feel like they need to. Let's see, next question. Here's a question for Peggy. What about staff who do not have a medical reason to be remote, but rather are allowed to be remote because their supervisor allows it? When can we expect those people to be back? This is more about, this is the same theme as the previous question. Why are some people held accountable and others aren't? When will there be a standard made by the university for all UND employees instead of by individual supervisors? Low morale and frustration are a very real thing for employees on campus every day. So I think I'm going to just comment upon this briefly. I'll speak to my division. So there are definitely jobs within the division of finance and operations where people are required to be on campus. And examples of those are many of the people in the human resources office that are required to be on campus because they have kind of a forward-facing function. They interact with the public to a certain extent. Other parts of the division don't require to be on campus exactly. And that would be a lot of the finance folks who do work, and they can do work in their home office as easily as they can do work in their office. And I can just tell you, since I interact with those people, just as an example, that their work is excellent and that the accountability that they're doing their work is excellent and that they have wonderful credibility as providers of key financial information throughout the entire campus. So, I think these things do kind of vary, and it speaks to a certain degree of frustration about, again, whether or not there's fairness and equity, in every place. And I think what we'll see is probably some degree of variability, but most importantly, it's time to think that the world may be changing a bit, and the idea that people must be at work all the time in order to be successful and accountable in doing their job may be a somewhat outmoded idea. We'll see how the world of work changes as a function of the pandemic over time. I think that, there are other jobs, and so I've talked about human resources. I think the same thing is true with the Department of Public Safety. Those folks are here. They really need to be here because they have to be able to respond to what's going on campus. And then similarly, large portions of my division are the critical people who keep the campus going. People are involved in operations and maintenance and also in building services. So those folks must be on campus. That's their job to be on campus. And that's really how this is going to lay out. So, I think we need to help people understand this. We have to monitor where the world of work is going. And we have to sort of take a more longitudinal approach to this question. But I think it's a wonderful question because it really is a source of frustration, and it's important to acknowledge it. Peggy, do you have any thoughts on this in addition?
Nothing really to add. I mean, I agree that, remote is kind of a world that is opening up more. We're going to see potentially some positions may not come back to campus. But this is an area where one size doesn't fit all. And so it's really hard to say, okay, everybody, and certainly the president he could say, I want everybody on campus. Everybody's got to be here. But it's not that simple. And so work can be done in so many different ways. And we have to remember that because we don't necessarily see a person in an office working, doesn't mean that they're not. They're working equally as hard. And as I mentioned before, if there are issues with work productivity, we've addressed them. We've helped supervisors who've come to talk to us about it. Remote work is not for everybody. Just like working in a standard office is not for everybody. And so these are opportunities that we have to sort of review how our work is done, how we engage employees, but certainly it's really new by and large for UND's campus. And so we have some growing pains. I just will add in here a little bit, there's some chatter about remote folks and closure days and so forth. And if it's a closure, should the remote person still be working? And the answer today is if the employee who is working remote when the university is closed is not an essential employee, no, they shouldn't be working. That answer may change. I don't know. I mean, this is something that UND should be, and we are going down the road to really try to figure some of these out. And we're not alone in the boat here. This is something that largely on a national scale, lots of different types of industries, including higher education, where remote employees has not really been a big thing, where it has been in some other private organizations such as Microsoft and, certainly larger, but those are paths that they've explored. And so I think higher education in general is going to have to explore some of these conversations, especially when we talk about recruiting and having some challenges for recruiting great employees into certain parts of the country. This may be an avenue for us to really, get employees who want to work for UND and would be really phenomenal for us, but don't necessarily want to move to North Dakota. So it's a large conversation. It's a complicated conversation. And, but certainly we do need to pay attention to how this shifts our culture and engagement of our employees on both sides, those who are on campus, those who aren't, and how we continue to engage teams and build trust for that work. I mean, those are things that we are beginning to really tackle and work through.
Thanks, Peggy. Another quick one, I think related to the issue of remote versus staying on campus is HR going to change the requirement for filing paperwork for employees to work from home regularly, full or part-time during the Omicron surge? That is, previously employees made arrangements with their supervisors. Then HR required formal paperwork for medical reasons to work from home when we were encouraging most employees to come back to campus full-time. But now it sounds like we may be returning to encouraging people to work home part-time to reduce the impact of the surge.
Yeah, so generally rule of thumb is so our remote worksite locations policy is for those who never come to campus, right? Or they work 30 days or more away from campus. If we're talking about for the next 2 or 3 weeks, we're not going to require paperwork that says this is what we're doing. The supervisors should work that out directly with their employees. They should work it out in their team. Who's going to be here? Who's going to be not? What does that look like? And certainly I think department heads need to be a part of those conversations. Your VP should be part of those conversations as much as they want to be. So for this uptick in Omicron, we don't expect to have documents provided to us unless this is going to be a long-term situation. And then we can go down that road. But at this point, if the outcomes are we're going to peak, hopefully, and come back down, early part of February, then I don't see the reason for us to have to go through all that paperwork to turn it back around. Yeah,
I think you're right, Peggy. I think what we're hoping for, we'll see what the reality is that this will be a fairly short spike, but we'll see. We'll see what happens. A question for Dr. Wynn. How long should you wear an N95 mask before you put on a new one?
So N95 masks are considered one use, so they should be disposed of after each use. And so that is the standard. For other disposable masks, I would say you should check with the manufacturer, but my preference is that they should be one use. Before, when PPE was in short supply, there were other considerations, but now I think, as was indicated earlier by Jen, that with good availability of masks, I would recommend that they're one use, regardless of whether they're N95 or not.
Thank you. So here's a question. We're going to go to inclement weather protocol, and this is a really good question. And so let me read the question, then I can comment, and I'll ask other people as well. So this will go to both Rodney Clark, Chief Clark, and also to Provost Link. During inclement weather, can supervisors receive more guidance on when we're able to allow staff to work remotely for the day, even though the campus is open? What is the protocol for closing the campus due to bad weather? The Monday where campus opened at 10 a.m. and then closed at noon created unsafe conditions for campus to report to work. So I just want to preface this by saying the fundamental goal is really twofold, for the campus, from my perspective. The first one is to try and remain open, and the second one is not to endanger anybody as a function of coming to work. So those are the two things that we really want to keep doing. And we try to remain as open as we can be because we got people here, and you know, if weather conditions permit, we do want people to come to work, and we want them to, but we want them to be in a fairly safe environment. So in the particular case that's cited, which is really a good one, it's a classic example of the difficulty of trying to get this just right. So, and I will turn to both Chief Clark and to Provost Link to provide a little bit more detail. But basically what you had happening was a storm that was forecast to lighten up after 10 o'clock, thus the campus opening. But alas, the storm did not do what was forecast, and in fact continued to remain difficult. And so really thinking about what was the best thing for people to do, the determination was made to close the campus early. Is that annoying? Absolutely. You know, is it a little frustrating? Yes, of course it is. But in fact, it was really done to try and get this right in a fast changing, rather dynamic environment. So with that, Chief Clark and Provost Link, do you want to add to that?
Yeah, thank you, Vice President Shivers. I can speak to the part of the question about somebody was asking about the protocols. And again, just like Jed said, being non-meteorologist, it's hard sometimes to get in front of like what the weather is actually going to do. So it's always a complicated call, and you're never going to make everyone happy necessarily. But what I do to start the process in the morning before I provide recommendations up is I try to tie my decisions to some facts. I look at the North Dakota road situation to see what roads are open and closed. For us, a big determining factor in that is, of course, Interstate 29 and then US Highway 2. Those are two main avenues that people that don't live in the city could be commuting on to get to work. So we try and look, and I can get that data in real time from the Department of Transportation to see, you know, what the status of the road is. Protocols for National Weather Service definition of a blizzard, you know, which happens to be fact-based. So you take some of the opinion out of it that, you know, the winds have to be at a certain miles an hour, you know, to be blowing the snow. Temperature is fact-based. We try and tie it to that. If we were to have ambient temperature sustained throughout the day of below 35 below zero or wind chill below 50 below zero is some of the facts that we try and tie it to. I know what whoever asked the question that day, it might have seemed frustrating to have people report in and then go home a little bit later. But like I said, it's always a complicated thing trying to predict the weather, not being meteorologists. But I think that we do, in consultation with getting actual reports and then reporting that up to the chain of command, you know, we try and get informed decisions that could be made. Is everybody always going to be correct according to everybody's opinions? The answer is no, because people have varying different degrees of what they feel is safe and not safe. And like I said, you can't satisfy everybody all the time. So I do think that we make a conscious effort to do that the best we can with, you know, meteorology by nature is like a dynamic and changing environment. So that would be my answer to the protocols of it. And I didn't know if the provost had some thoughts on it as well.
I'll merely echo what's already been said. It's not an exact science as much as we would like it to be, at least from our side of the, you know, despite our colleagues in meteorology, for us who have to render these decisions in real time about the safety of people traveling to and from campus, it feels very inexact at times. But despite the annoyance and inconvenience of that particular case, for instance, where we thought we could open at 10 and did, and then wound up sending everyone home at noon, that decision was made based on the changing weather conditions and an attempt to keep everyone, despite the annoyance, as safe as possible on the roads. One of the things, and I hope I'm not misremembering, Rodney, but I think we learned around 11:30 or so that day that the city was having trouble clearing the streets in a timely fashion. And I think they were even going to halt the plow service sometime in the afternoon. And we wanted to get folks home before that happened. So, so anyway, that's how that particular decision was made. And I appreciate everyone's patience and understanding.
Thank you, Provost Link and Chief Clark. Quick question on status on the search for VP of Student Affairs. Can we get an update on that, please?
Absolutely. Great question. It's a vital position for our campus. We have a search firm selected. The contract will be finalized tomorrow, the 13th, and our initial meeting with the search firm will be on Friday morning. Chairing the committee is Vice President Melanie Linder, and we're assembling that search committee. We have nominees already. I think she's touched base with most, if not all of them, and the work will begin right away. On the back end, just to give a sense of it, it's probably going to be a 3 to 4 month search process. So my goal is by commencement, we have a new Vice President for Student Affairs selected, and a great opportunity for me to thank our current Vice President for Student Affairs, who's serving on an interim basis. This is Beth Helwig. Dr. Helwig, thank you so much.
My pleasure. Thank you, Dr. Armacost.
Okay, quick question for President Armacost. What is the status of vaccine requirements for those working on federal grants and contracts?
Well, currently the cases are under review. So there were 3 federal rules that were found in the courts and are heading up to the Supreme Court. My understanding is they were heard on Friday, the 7th, last week, and we're just eagerly awaiting the final disposition. Currently, there is a nationwide injunction on the requirement for federal contractors to vaccinate. So we haven't implemented a vaccine mandate. We will eagerly await the results of the Supreme Court's decision and let people on campus know exactly where things stand. But for now, no vaccine requirement on campus.
Thank you. Quick question for Provost Link. I teach face-to-face classes this semester and prefer not to teach those classes in hybrid format, but how to handle requests from students who want to participate online. Any thoughts there, Provost Link?
Yeah, this is a great question, and I see a couple layers to this question. So if a student is test positive for COVID, I know this is probably not exactly what the asker is asking, but if a student in a class tests positive, needs to be quarantined for even an abbreviated quarantine period of 5 days, let's say, I do hope that faculty across campus will continue to work with those students, allow them the opportunity to catch up on their work and to continue to make good progress in the class. So that's where our continued grace and flexibility on campus comes to play. But in terms of the other side of this, if it's, say, a face-to-face class and a student in the class says, I want to take this class, but I want you to deliver it to me online, faculty are not expected to teach the same class in multiple modalities. So if it's a face-to-face class, deliver a great face-to-face class. If the student is not willing to stay in that class, they can work with their advisors to try to be placed into a different course that better suits their needs or their schedule.
Okay, thank you, Provost Link. So I think this is a question for President Armacost and maybe Provost Link as well. How will the criticism of the task force on the future of higher education's report impact selections for the strategic plan committee? Many of the comments raised legitimate concern, and more than a few noted the task force focused on tenured faculty as a point of concern.
It's a wonderful question, and all the inputs that we've gotten from both task forces will certainly influence the direction of, and the comments that have subsequently come in will certainly influence the discussion about the strategic plan. It will certainly influence how we build the teams to look at the issues that the strategic planning committee is going to look at. So in terms of placement on the strategic planning committee, there are positions there as well. We'll be mindful of key areas identified in the task force report and the response, and make assignments accordingly to that committee. And then in addition, we will likely have multiple working groups that, as we define the goals or the themes of the strategic plan, that will actually do detailed work on those items. And there'll be an opportunity for folks to contribute there as well. Again, we'll solicit volunteers widely for all of those activities. Provost Link.
Oh, yes.
I don't have a great deal to add here, but I certainly want to point out that the work of the task force was significant and important, and we are certainly going to make that final report part of the overall document library that will be referenced during the strategic planning process. We have a great deal to sift through and to learn from in terms of that report, and we certainly want that work to influence and speak to the strategic planning process. But it's only one input. There are other inputs as well that also need to speak to the strategic planning process. The DEI task force report, the current and will be soon prior strategic plan itself will be an important input. Our gap analyses that we do, I mean, all the accumulated work that goes into understanding who we are, where we are, and where we want to go. So that task force report will certainly be influential, but it's just one of many inputs that will be looked at by the Strategic Planning Committee for sure.
Thank you. Okay, well, we're at 2 minutes before the hour. I'm going to turn this over to President Armacost for closing remarks, but I have one last question, and this is to Athletic Director Bill Chaves. Can you address the rumor that the hockey game is canceled this weekend, or hockey games are canceled this weekend due to positive cases at UND?
Yeah, unfortunately, Jed, I can confirm that games will be postponed this weekend due to a roster limitation in our program. So unfortunately, that is the case. We're hoping that we can work with the conference and reschedule. So stay tuned in that regards, but it just literally got sent out by the conference just a minute ago. So I'm glad we're able to say it on the town hall.
Thank you, Bill. Thanks for sharing that with us. Sorry about that outcome. President Armacost, do you have any closing comments?
Yeah, just thanks for the rich set of questions and the thought that you've put into them. As I mentioned before, we'll do our best to answer the ones that we didn't get to here. Let me express my appreciation on behalf of everyone here for the extraordinary work that you've done to get ready for this semester and to really take this important mission so much to heart. And we're here for our students. We're here to make a difference in their lives. We're also here to look out for each other and to keep the learning and discovery processes alive on the campus. Hopefully today was useful for you in terms of getting you this very important information about everything from Omicron to I mean, everything that we talked about today, mostly Omicron. But we'll see you soon. Thanks for tuning in.